Good morning, everybody. Monday morning, 9:30, time for class. So I had a pretty good weekend, rested up. Um, Lots of people wanting to talk about things that we talked about last week. So I heard from a lot of you about progesterone and the skinny shot. Um, Today we're going to talk about the Hercules shot. Morning, Linda. The Hercules shot, I talked to my son this weekend, and I told you Friday we were going to talk about Hulk serum. And that was kind of a name I came up with about 3 years ago. I haven't really publicized it. He says, "Ooh, you're going to get in trouble from Marvel and Disney, and they're going to come after you." And I researched that, and actually, Marvel Comics owns the word Hulk. They've trademarked that word. Now, I'm not sure exactly how you trademark a word, but apparently they did it. Morning, all of you. So my other my other term for this was Herculean serum, Hercules shot, etc. And that's a mythologic figure, so you can't trademark Hercules. Okay, so this is another, and I've got several of these. I've got quite a few shots that I've used over the last 6, 7, 8 years. This one, about 3 years ago, I started using in St. Louis. And this is a mixture of amino acids. The shot is GACLIV, GACLIV. We're going to go through each part of what that means. So GACLIV is the Hercules shot. It's given once a week for 30 weeks. And it's really for people that are not necessarily losing weight. It's for people that are working out and they're trying to build muscle. And so if you're working out and trying to do that, of course you're going to turn, you may not necessarily lose weight because muscle weighs more than fat. But there's also the repair thing. So anybody that works out and does a lot, does weightlifting or whatever you tend to do for physical fitness, there's a recovery period. So the Hercules shot is designed to help you make protein in your muscle and help you recover faster from a workout, so that burn goes away faster, and also lose fat. Now remember, if you're in a reasonable weight category, and I remember this from 20 years ago. I took care of a young woman who was 31, and she weighed 165 pounds, but she was a semi-professional athlete. So for her, it was volleyball. So she played a lot of volleyball, and her percent body fat was probably 10, maybe 11. So it kind of bothered her that she weighed 165 pounds. She thought she was fat. She had a perfect muscular toned athletic body. And people have to realize that muscle does weigh more than fat. So I used to keep a 5-pound model of muscle and a 5-pound model of fat in the office to show people the difference between the size of these models. So the 5 pounds of muscle was like maybe this big, and the 5 pounds of fat was like this. So you do have to keep in mind that muscle and fat weigh different. Okay, so let's talk about the Hercules shot. So this has in it glutamate, arginine, carnitine, lysine, isoleucine, and valine. They're all amino acids. The strength on those are 25, 100, 200, 10, 10, and 5 milligrams per cc, per milliliter. Okay, so glutamine is a naturalist. So we'll talk about each one. GAC-LIV, or the Hercules shot. Glutamine is one of 20 naturally occurring amino acids in the dietary protein. And Actually, it's the most abundant amino acid in the bloodstream, and it's about 30 to 35% of the amino acid containing nitrogen that's in the bloodstream. So, I've got to flip through here. I've got all this open. And so, glutamine, I'm going to get back to it. Sorry, I've got all these things open, and what I want to do is go through each one. Okay, so it may be one of the most overlooked supplements. So there's glutamine powder, and of course, we talked about the Super Skinny Shot on Wednesday. You can get all the ingredients in the Super Skinny Shot as a powder. You can take supplements, whatever, and add it all up. It would be similar in price, I think, to injecting it. Maybe it wouldn't last as long if you took it as a powder or as a oral supplement. But remember, we talked about the different ways of administering supplements or medications in general. So oral is oral administration of medication is probably one of the worst ways that you can take something, because there has to be fillers and the absorption rate is not that high. Same thing with vitamins. If you want to figure out if your vitamin's actually getting in you, take one of your vitamin pills, whatever you take, put it in an 8-ounce glass of water and walk away for about 30 minutes. And however much of the pill is still undissolved after 30 minutes, that's how much of it is waste. So oral administration of medications and supplements, and I do a lot of them orally, is probably not the best way. Intramuscular administration, so a shot, is a way better way of getting things into your bloodstream. And it also bypasses your liver. So if you take anything orally, you're going to have to go through your liver. That's the way your body works. And so an intramuscular dose of a supplement actually gets straight into your bloodstream. Okay, so glutamine may be a mystery to you. You might not have heard of it. It's kind of an underrated amino acid, but there are a lot of benefits of glutamine. So it can help you with bloating. Okay, so let's say that you're on a caloric restriction thing on whatever. I hate the word diet, so it's kind of dietary modification or altering the way you eat. And let's say that you are low carb and you decide on the weekend that you're going to eat some carbohydrates. Well, if you've been on a ketogenic diet or a low carb diet, and you all of a sudden kind of cheat, you're going to bloat. And glutamine is one way of banishing the bloating that occurs when you kind of fall off of what you're not supposed to do, but what you're trying to achieve, I guess. Glutamine also supports your immune system. It helps heal your gastrointestinal tract. It is the most abundant amino acid in the blood as well as in muscle cells. It's a conditionally essential amino acid, which means your body can make it. However, under certain conditions, especially with people that are doing intense exercises, glutamine levels deplete, which means that more glutamine's required. So if you're a workout person, you're depleting your muscular nitrogen and your glutamine. You need your nitrogen for protein synthesis, right? So what does it do? It has several functions. It supports immunity. It helps with gastrointestinal or integrity. It modifies insulin secretion, and it's involved in neurologic activity as well as muscle protein synthesis, which is why you're after it with a thing called the Hercules Shot. It supplies 35% of nitrogen to the muscle in order to synthesize proteins in the muscle. So the benefits of maintaining a high nitrogen balance in the muscle prevents muscle breakdown. Therefore, you retain more muscle. So that makes you leaner. So if you're leaner, you have less body fat. So in essence, just by itself, glutamine may help reduce overall body fat. Okay, are there studies that prove this? Well, most supplements are over the counter. There's not a whole lot of money involved with taking supplements, so there's not a whole lot of studies. So I'm not going to tell you that it's going to fat burn glutamine. Even the Skinny Shot is, there are fat burning elements to the Skinny Shot, and there's fat burning elements to the Hercules Shot. But once again, these statements have not been evaluated by the FDA, and these supplements are not intended to cure or treat any illness. What you're trying to do with supplements is improve your health or maintain your health. You're not curing anything, right? Okay, are there side effects? So you can eat foods that have glutamine, and almost all these amino acids are involved in eggs and meat. So people that are vegans typically don't get enough of the essential amino acids, and we'll talk about some of these. So if a vegan is working out and they're needing more glutamine, they're not probably going to get it from their diet. So you pay attention to the dose. You run anything past. You work with a healthcare professional if you're planning on doing any of these supplements. I'm one, but I'm just not practicing medicine, so I'm a health coach. But I do have a medical doctorate, so I can kind of lead people into the right supplement and make sure that it doesn't interact with medications, right? So one of the nice things I talked about was the bloating, the reduction in bloating with glutamine. Well, it has the ability to draw water and salt into muscle cells. Okay, so a well-hydrated muscle cell and muscle in general is a healthy muscle. So protein synthesis happens faster when muscles are enlarged and swollen, meaning that glutamine increases cell volume as well as muscle protein synthesis. It has some anabolic effects as well as immunostimulatory effects, meaning it can help your immune system function properly and kind of give you a boost. And right now we all need immune function. So I keep telling people zinc and vitamin C. This particular injection has an immune boosting. So does the Super Skinny Shot as well. So it actually helps with muscle repair. Okay, so glutamine decreases muscle soreness through improved muscle repair and glycogen repletion. And so glycogen is the stored form of glucose. And it can be stored in the liver as well as right in the muscle, so that you can use stored when you're working out. You need carbohydrates. And so if you're not eating them, so if you don't do a carbohydrate load before a workout, you're going to have to use the glycogen that's stored in your muscles. This supplement's also been used with people who have irritable bowel syndrome, celiac disease, and other digestive issues involving glutamine in a protocol to help treat the intestinal lining and reduce the symptoms of bloating associated with those problems, right? So it's a cool little thing that's added to the Hercules Shot, or the GACLIV, G-A-C-L-I-V, GACLIV. It's actually easier to say Hercules Shot, right? Okay, the second part of the injection is arginine. Okay, so we're going to talk about arginine. And I think we talked about arginine. It's a precursor to nitric oxide. It's also in the Super Skinny Shot. So just like the other amino acids, proteins, L-arginine plays a role in building protein. The body uses that protein to help build muscle and rebuild tissue. Okay. As a matter of fact, L-arginine has been used in the treatment of severe wounds and then tissue wasting and serious illnesses. Okay, so I'm looking at a picture from Pinterest of the food that contains L-arginine. So I'm looking at a picture of shrimp, a T-bone, sausage, salmon, ham, and eggs. And so once again, if you're working out, if you're working out and you're a vegan, you're probably not going to get that from your diet. Okay. It is also, sorry, the allergies are bad this morning. L-arginine helps release nitric oxide in the blood, and we spent a whole class on nitric oxide about 3 weeks ago. So this is, and the fact that L-arginine being taken orally is not a good way to boost your nitric oxide unless you mix it with that drink that I have that has berries in it. Well, this is a way to give your, to get your L-arginine levels up by an intramuscular injection, so you're bypassing that oral breakdown of L-arginine. Okay, so you're releasing nitric oxide in your bloodstream from the endothelial cells that make it, the ones that line the arteries. They make nitric oxide and dilate blood vessels and improve blood flow. So that helps with circulatory conditions. Also, perhaps may help with people that have narrowing of coronary arteries from plaque buildup from coronary artery disease. It also helps with blood pressure. People with hypertension, if you relax blood vessels with nitric oxide and boost nitric oxide, you help lower blood pressure. So once again, L-arginine in the diet, red meats, fish, dairy, and eggs, okay, help the body replenish those necessary resources for L-arginine. And your body produces L-arginine under just normal circumstances. So once again, the Hercules shot for people that are, that are training, and I don't mean for the Olympics. I'm telling you, people that train don't necessarily want to be huge and look like Arnold Schwarzenegger. Some do. And this works for men and women. I mean, I said it's not just for men. I called it Hercules. But there are plenty of women that work out and are physically fit, and they lift weights, etc. Okay, so L-arginine levels increase, or the requirements for increase as people age. And then with certain medical conditions, you can have, specifically high blood pressure, you can have reduced conversion of L-arginine to nitric oxide. Okay, you can get it orally, you can get it in injections, you can get it compounded into creams. I like injections. It goes straight in the bloodstream. You know that it's in your bloodstream because it's been given as an intramuscular injection, right? Too much L-arginine, so this is why this is a blend that's compounded specific. You can have some side effects from anything that you overdo, right? The two effects of L-arginine are nitric oxide and helping the body build protein. So it has an array of benefits: heart health, chest pain, developing muscles, repairing wounds, can even improve male fertility. So the following list are some examples that have been researched for the benefits of L-arginine. So there's a growth hormone reserve test. So this helps actually stimulate growth hormone production in the body. It's shown to reduce high blood pressure. It does help potentially with people who have heart disease. It's been used for erectile dysfunction because nitric oxide is the pathway for erection in men. So Viagra and Cialis, and the other one I'm blocking, alter nitric oxide, so it improves nitric oxide. So this is another way to improve nitric oxide that's way less expensive than Viagra. If any of you that are listening have used Viagra, it's expensive. Okay, it also improves inflammation of the digestive tract, and it can improve blood sugar in people with diabetes. Potentially, with further research, it could be helpful with improving blood flow, healing wounds faster, perhaps alleviating anxiety, treating burns, improving kidney function in people who have congestive heart failure because of the improved blood flow, right? Okay, the next one is carnitine, and we talked about carnitine with the Skinny Shot. Here's the fat burning part of the Skinny Shot. So what you're doing with carnitine is burning fat. So you're helping transport cholesterol. You're helping glycogenolysis, and you're helping glucose levels. And what it does is help with mitochondria. So it transports fatty acids that you eat, so starches, into the cell's mitochondria. And the mitochondria, if you remember, is the powerhouse. It's like the generating motor of a cell. It's where ATP, adenosine triphosphate, is produced for energy, like some of the channels, sodium, potassium, hydrogen channels in a cell wall that require energy. So it's the energy producer of a cell. So carnitine is an essential nutrient. Okay. Typically, once again, for vegans, they typically do not get enough or may not get enough carnitine in their diet. It's produced in your body. You can also obtain small amounts by eating animal products, so meat, fish, not necessarily eggs. There are several types of carnitine. The one that's in the Hercules Shot is really L-carnitine. And so, once again, L-carnitine for mitochondria and energy production in your body. So if you're working out, you need energy production. That's one of the ways that muscles work, right? 98% of L-carnitine is contained in the muscles. There's a small amount in the liver and a small amount in the blood. So it is involved, L-carnitine is, in that mitochondrial function, and it's involved in healthy aging. Okay? So once again, an amino acid derivative transports fatty acids into your cells to be processed for energy. So is it a weight loss supplement? Well, it's part of the Skinny Shot because of that, because of the moving of the fatty acids to be burned for energy. So it may be that it helps burn fat. So it's that combination of things, the way you eat, what you eat, what type of activity level that you're doing, in addition to these supplements that we're talking about with the Super Skinny Shot and the Hercules Shot, right? Okay, next one is lysine. Lysine is, actually I said lysine, it's leucine. Leucine is important. It's one of the 9 essential amino acids. So in other words, it's essential. You don't make it, you have to eat it. You have to get it in your body in some other way. So again, lysine, important for protein synthesis, contributes to the regulation of blood sugar levels. It is involved in growth and repair of muscle and bone tissue. It helps improve human growth hormone production. It's also involved in wound healing, and it also prevents the breakdown of muscle proteins after trauma or severe stress. Okay, so does it mean that you're traumatizing your muscles by working them? Sort of, kinda, in a way. Okay, so you do have to repair. So this is you do have to repair your muscles after you stress them. Okay, so leucine, and then isoleucine. We're going to talk about them together, and then valine. So the last 3, the live part of the GAC-LIV, are branched chain amino acids. They're essential amino acids. Their carbon structure chemically is marked by a branch point. That's why they're called branched chain amino acids, BCAA. They're critical to human life. They're involved in stress. They're involved in energy, and they're involved in muscle metabolism. Okay. Branched chain amino acids have been used therapeutically, both oral, intravenous, and intramuscular. So valine, isoleucine, and leucine, or leucine, isoleucine, and valine, the live part, And they're structurally similar, but the branched amino acids have different metabolic routes. So valine is involved solely with carbohydrate metabolism. Okay, leucine is involved in fat metabolism, and isoleucine is involved in both carbohydrate and fat metabolism. So there's different requirements for those essential branched chain amino acids, but they have different deficiency symptoms. So valine deficiency, and most people aren't going to get valine deficient. You can have neurologic defects in the brain. Isoleucine deficiency can give you muscle tremors. Branched chain amino acids are decreased in people that have hepatitis, liver comas, cirrhosis, and mainly liver involved problems. And if you take too much, so these, like I said, these blends are, we've worked together with compounding pharmacists, and when I looked around at different compounding pharmacies, I've used the same one for about, I've used the same two for about, combined about 30 years. These are pretty much made about the same way. So I call it the Hercules Shot. It's GAC-LIV. So you can find GAC-LIV from different, Empower Pharmacy, different pharmacists. South Lake Pharmacy in Chicago makes GAC-LIV. So it's kind of interesting to see if everybody uses kind of the same type of blend, and they do. So when you blend stuff together, most pharmacists and physicians and people that work on this are kind of using the same kind of dosing. So you're not doing anything that's out of control too high. Okay. All right. So each one of these, leucine, valine, isoleucine, they help repair lean muscle mass. So if you're working out, you're going to recover from a workout faster. That burn from lactic acid buildup, that's what gives you that muscle burn after leg day. That is a repair. So the lactic acid goes up, it hurts, it's achy, it's kind of a good ache. But this injection, the Hercules Shot, helps repair that faster. Okay, leucine helps regulate blood sugar, helps maintain it helps maintain the body's energy level, also temporarily increases growth hormone production. Okay, isoleucine, known for its role in increasing endurance. So if you're working out, because of its metabolism of carbohydrates as well as fats, it helps you with athletic endurance. It helps repair lean muscle mass tissue. It encourages blood clotting at the site of an injury. And potential health benefits for athletes because of the primary role in the body to increase energy and help recovery from strenuous exercise. So you can get, if you're strenuously working out, and I know a bunch of people that do, that's always that lactic acid burn afterwards. And so that goes away faster because of these three branched chain amino acids. Valine may help remove excess nitrogen from the liver and transport to the body. Remember, nitrogen is needed for muscle protein synthesis. Also studied as an Missouri lingo, as an adjunctive nutritional support in people with liver and gallbladder disease, specifically people that have difficulty with alcohol abuse and drug abuse, and reversing alcohol-related brain damage, and that's from thiamine deficiency. So anybody, a health coach that likes to drink, I put them on milk thistle, and I have them take thiamine, because thiamine deficiency leads to pickling of the brain, as one friend of mine used to call it, or Wernicke's encephalopathy. So we are right at almost 30 minutes. I tried to do these in 30 minutes. The one Friday went 43. So that is the Hercules Shot. Got that one on sale as well. So anytime I talk about one of these injections, I usually put them on sale. I decided to add the month of July for the super skinny shot, so it's $50 off for the entire month of July. I'll do the same thing for the Hercules shot. Hit me up with a DM if you're interested in that. It's not just for athletes. It's not just for men. It's for anybody that wants to be healthier, right? Boost your immunity, boost your energy, help you lose body fat, help you gain muscle. That's the Hercules shot. I will talk to you Wednesday morning at 9:30. I haven't decided what I'm going to do yet, but I'll have it figured out by the time I get on here. So have a great day. It's looking pretty nice. I don't see any, the Saharan dust storm is supposed to be here, and somebody put up a picture from St. Louis, a friend of mine from St. Louis last night. Didn't think it was doing anything for the sunset. Same thing here in Boondale. Somebody put up a picture of the sun setting behind the Katy Bridge. They kept saying, "Ooh, it's going to make the sunsets and the sunrises so nice." Haven't seen it yet, and it's supposedly here. So I will talk to you in 2 days. Have a great week, and peace and health to all of you. See ya. Bye.